So if we think about the psychological impact of COVID-19, what comes to mind is definitely trauma. People are traumatized, and I think they're traumatized as a result of single or individual events, but also traumatized by this collective trauma that we're going through. So if we talk about collective trauma, we often reference things like the Holocaust, or September 11, or even in the South African context, apartheid. But the COVID-19 pandemic is our modern day collective trauma. If you think about it, every person in this world is questioning their safety in the world. So, we get a certain sense of security and calm and ease and peace by knowing that we are safe in our world. And currently that is being challenged at its very core, because we are told all day, every day, that the world is not safe for us. How we function in the world is no longer safe for us. And that can leave so many people, and has left so many people, traumatized simply by the idea of the pandemic, even before we get to what the actual impact has been. And we are faced with our own mortality, and that is a very stressful, anxiety-provoking thought. The thought that you or a loved one, somebody that you love and care about, could die as a result of this virus that is so easy to contract, and that is so deadly for so many people, has really been stressful, scary, anxiety-provoking, and has caused many people to feel completely overwhelmed about their place in the world and how they function. And that's been really, really stressful. To live in a world that you are afraid of living in. You can imagine the psychological impact that could have. If you think about the impact of children not being able to play with their friends the way they have become accustomed to, or how we relate to other people. The most basic processes, the most basic parts of life have completely changed, and that has had a huge psychological impact on so many people living through the pandemic. We also look at the trauma that the illness itself has caused. So, we've had so many people talk about the trauma that they've experienced of watching a loved one or a family member or friend suffer through COVID-19. So if they've become ill with the virus, people are saying things like, watching my mom gasp for air. I can't get that picture out of my head. People being really traumatized and completely overwhelmed and emotional and stressed because they cannot access healthcare services for their family members who are at home and who are clearly very, very ill, or who have had severe symptoms. So family members having to care for COVID positive patients at home who don't necessarily know how to do that, or who aren't equipped, and when they finally give up, struggling to get access to healthcare services. We've had so many people say that even just watching the ambulance come and take their family members to the hospital, or dropping their family members off at a hospital, and not being able to accompany them, has been so traumatic, and has been completely disturbing. And it's left them, people have said, I'm a wreck. I don't know how my family or how my loved ones are when they are in hospital. Patients themselves reporting that they had quite a traumatic experience by being treated. Just being COVID positive was already so anxiety provoking. Needing hospital care was anxiety provoking. And then also just going to a hospital or doctor which, in normal life is an everyday occurrence and not really something to be stressed about. But being treated by somebody who's in a hazmat suit, who's wearing a mask and gloves, and who is trying to have, keep a safe distance and sanitizing all the time, that experience has been traumatizing for the patients as well. And then we also have those patients who have needed to access life-saving medical care in ICU, traumatized by that experience, being traumatized by saying there were 5 people in the ward and they were all gasping for air. There were so many machines, the lights, the sounds, just having people relay those experiences is indicative that patients are really traumatized by the experiences that they've had. I think on top of that as well, for the family members or the loved ones who are left at home, the stress or anxiety of not being able to get regular feedback on their loved one's progress. Some people reporting saying, we dropped them and that was the last time we saw them, or the ambulance came and took them away, that was the last time we saw them. We made several calls to find out how they are. Eventually we got some feedback, and the next call was that the person had passed away. So just the fact that people didn't have access to their loved one who was sick, and possibly didn't have access to information about their loved one's progress, was also quite anxiety provoking and very difficult for the family members or loved ones at home to deal with. And so there's really trauma and stress and anxiety on so many different levels. People are traumatized by death. So there has just been an overwhelming exposure in the news, but also personal experience of loss and death. Literally getting the news every single day of somebody who knows somebody who has passed away, or for yourself finding out that a colleague or friend or a distant relative has passed away. So there's been so much loss to death during the pandemic that it has become quite overwhelming for so many people. We know that death is not something that is traditionally faced alone. So for most people, people come together when there is loss to death. So we don't necessarily, whether you are the person who's dying or whether you are the loved ones or family members of somebody who's dying, it is not generally something that is faced alone in most circumstances. However, during the pandemic, people were forced to face this very difficult time in their life. Probably one of the most, or definitely one of the most traumatic experiences in life is losing someone to death. And so many people were forced to face that alone. So those who were dying, in hospital, they didn't have their family members to say their final goodbyes. The family members or the loved ones didn't have the opportunity to say their last goodbyes, to let the person know that they were loved, that they were cared for, those things that are important when one is facing death wasn't possible. And that has left a huge gap for so many people who are trying to process their experience of loss. If when there's death in most communities, there's a coming together. There's a sense that people physically come out to support individuals, whether that's financially with their presence, helping with cooking, having prayer meetings or services, memorials, things like that. It's very social, and it's important for those who have lost someone to process those emotions, to process the loss, to acknowledge where they are at. That support's important. And for so many people, that essential part of dealing with loss has been absent during the pandemic. I know of so many people who have had to attend parents or siblings or significant others' funerals via a virtual platform. So either using Zoom or Teams to be present at the funeral, at least virtually, because either they were exposed to COVID or they were COVID positive, but for some or other reason related to COVID were not able to attend the funeral. So many people who have lost loved ones, close family members, who are really struggling with the fact that they couldn't hug their family members who were struggling, that they couldn't sit with them, that they couldn't hold their hand. For so many people, they've struggled with the lack of that ritual. And so we anticipate that in the future, we definitely will see the psychological and the emotional and the impact of this on people's mental health long term. Things like complicated bereavement and complex trauma is going to rear its head in the near future, and those people will definitely need support when they continue to struggle. And then we also think about, or we need to consider the trauma, the overwhelm, the stress, the anxiety that has been caused by job losses. So there are so many families who have either needed to survive and make ends meet on a salary cut, so the income was significantly reduced, although they were able to retain their employment. There were so many families where individuals have lost their employment, so they've completely lost their jobs and there was no income. There's several families where there were multiple job losses in one household, and just the stress and strain of that financial challenge, keeping a roof over your head, making sure that the family is clothed and fed and safe during lockdown or during the pandemic, compounded by all of the realities of COVID-19 and lockdown and all those struggles, has really started to take its toll on so many people. And so job losses has been a major, major impact on people's current mental health or their overall well-being. And then we know that people who have retained their employment have different challenges. So the world of work has changed so drastically in such a short space of time that it's left people spinning. So many people are reporting that they're just not able to get used to this way of working, or they haven't yet found their routine. So yes, some have been able to adjust and adapt, but for many people who have to work under different circumstances, they're still struggling to adjust. So for those who are still having to leave the home to go to work and perform whatever functions they need to, it is extremely stressful and anxiety provoking to work knowing that you can at any time be exposed to a very deadly virus, to a virus that has taken so many lives, to a virus that we know so little about. And so that's really been, very stressful for employees who need to still go out to work. And for those who are working from home, the work environment has changed. So for some people, they're sitting at their kitchen table, they're sitting on their beds, they're sitting on their couches working. Not everybody has access to a spare room to turn into an office, for example. And all of those things affect your level of productivity and your overall well-being. There's no longer that separation between home and work. And we also take on these different personas in the different parts of our lives. So how I present at work is not necessarily how I present in my personal space at home. But now those two are having to be married. And at the same time, people are having kids at home, spouses at home. There's the added responsibility of needing to make sure that you provide for all of the meals during the day and all the needs that the rest of the family may have. And that has definitely changed the world of work, even for those that are working from home, for example. And then we have the challenge that not all is fair in the world of work. So not all employers are safeguarding employees in the same way. So yes, we've got our recommendations from the World Health Organization, from the Department of Health, the Department of Labor, but those measures are not necessarily strictly applied by all employers. And so many employees have been left feeling frustrated, angry at their employers, disempowered, having to work under conditions where, they don't feel safe. And that's added additional stress and strain to individuals, and has definitely impacted performance and productivity, for example. We know that so many people have reported that although they have been trying to follow protocols and calling employers to say, I'm not feeling well, or I have been in contact with somebody who is awaiting their test results and being told that they still need to show up for work. So knowingly, potentially putting yourself at risk or your co-workers at risk, but being forced to make a decision between, my employment and staying at home, to isolate and follow the precautionary measures, has also placed a lot of strain on employees in the world of work. And so it has been really challenging to remain productive. And so many people or employees have also reported that there's this expectation of super productivity and almost a lack of empathy from employers to understand the circumstances under which people are producing or working at the moment. People talk about Zoom fatigue and, this excessive need or this need for excessive meetings. So people reporting that I spend my working hours in meetings and then I've got to do my actual work in my personal time, after hours or on weekends. And so the working world or the work environment has become even more challenging than it's been prior to COVID-19. And I think we are going to see the impact of that on individuals. We are going to see the impact of the impact that COVID is going to have on productivity, or has had on productivity. We are going to see that in the medium to long. And then we also have employees who have reported, or individuals that have reported, that even when they have tested positive with COVID, or family members have tested positive with COVID, employers have not necessarily been very understanding or supportive, still expected a certain level of productivity, and that's contributed to that feeling of complete and utter overwhelm when it comes to work and being able to meet all of those needs. We will definitely see the impact of COVID-19 and the lockdown on people's mental health and their psychological well-being in the long term. Already we're seeing more and more people accessing services for heightened levels of stress, heightened levels of anxiety, people with a history of depression, presenting with depressive episodes, and people being diagnosed with depression for the first time in their lives. So we will definitely see the impact that, COVID-19 has had on people's mental health, the isolation, the impact that the isolation has caused, the impact of people, for example, being isolated and on lockdown with their abusers. For many people, they go to work or go to school as an escape from very challenging circumstances in the household. And for many, many people, that was not a possibility for months on end. And we are definitely going to see the impact on mental health in the long run. I feel that we need to create space for people to discuss and explore and share their experiences during COVID. I think we need to create space for everything good that has come from it, but also all the challenges that were faced. So many people have experienced very, very difficult things during COVID and haven't necessarily had the space to process those experiences and the emotions that came along with it. For some, because everybody is going through it, they feel like I should be coping with it. And so there's almost been a lack of reaching out for support because this is normal for everyone. I'm not special. I'm not different in any way, so I should be coping. And for that reason, not accessing the support that they need. So I feel like space needs to be created for all individuals who have lived through COVID and who continue to live through COVID to process those experiences and need to be educated on when they need specific help with their mental health challenges, for example. So a lot of education, psychoeducation will need to be done around how do I know that I'm coping well or not? How do I know that I need support from a mental health practitioner or a different type of support service? And so I definitely feel like we need to create that space and we need to make mental health support services available to those who need it to help deal with the long-term effects of COVID-19.